Welcome to my podcast. Today I'm going to talk about another important condition, and it's common to seen in the UK. So it's about sexually transmitted infection. So basically, after you introduce yourself, double check the patient name and date of birth. You'll ask, "How can I help you today?" So the patient might come and maybe furious, maybe shy, maybe embarrassed. They'll tell you, "Doctor, I'm having an issue down below." So you'll say, "Tell me more." So the patient might say that I'm having too much discharge, whether from the male or female. They might have soreness, pain when they wee and pee, and maybe they have pain and the back passage. They might say that I'm having rash, or maybe I'm having bleeding, having too much itching, might have some soreness with some blister, tiny one, and maybe they have some lumps like genital wart. So all of that thing is related to that area. So basically, in those kind of situations, it's usually seen by the gum clinic and not by mostly the GP. So they will refer them to the gum clinic, which is specified about specific sexual transmitted infection. So the patient can go and maybe drop in without even an appointment to be seen, and maybe to be screened quicker than in the GP. So they will tell about major question. There will be about their sexual activity. So how long they started sexual activity, how frequent, how many partners do they have, what's the method of sexual activity that they do, because there's certain types. So also you will ask about if this involves any use of sexual toys, and then you will guide them through. So I might send for certain investigation, of course, often asking the patient what's their idea or thoughts of what's going on with them recently, because the patient will guide you, and sometimes they know what's basically going on and how they acquired that, especially if the patient has multiple partners. So you will just start to think what might be, and of course don't forget to ask about the lady, if she's pregnant and when does she have her last menstrual period, and if it happened that she's might be pregnant. Then you try to filter your differential in order to narrow it down, and also don't forget about asking if when the patient say I'm having discharge, you will ask, can you describe this discharge for me? Does it have any color? Is it fluid? Is it thick? Is it cheesy one? If it has any blood streaks inside it or around it, and what's the color of the urine. And also you need to ask if there is any past medical history, like for instance diabetes or any other disease, and if they have any soreness, for instance, in their mouth or in their eyes, which could point to other associated disease, which could be a different thing, of course. And then you will try to filter and narrow down your differential according to the presentation. For instance, if the patient have itchiness, if it's discharge, you will ask if the spouse or the partner have the same symptom, in order to think what might be the cause. And also you will ask about their hygiene, if they, for instance, they look after their private area, and what they do and what they use. And then you will, of course, come up to a specific differential according to the presentation, and you will ask the patient that I need to examine you, and of course you have to take their consent for a chaperone, because this is intimate area. And you will ask if they prefer a male or a female, because sometimes if it's a woman, she usually would like to see a female doctor with a female chaperone, and vice versa. And then, to see what could be the main differential. Say, for instance, the most common sexually transmitted infection in the UK is chlamydia. So always you will ask about what sort of sex practice do they do? Do you use safe practice or not, especially in young teenage and adult? And what symptoms do they have, and how do they think that they acquired this? And of course, you will treat it according to the. I mean, if you send for a certain specific test, you will treat it accordingly. I mean, with the right antibiotic for that condition. For gonorrhea, it's another common thing as well, and should be treated, of course. And also, you will ask if they have using any, as I say, any sex toys or vibrator, if they wash the area, if they clean properly. So all of that you need to inquire about it. And of course, if you have any thought about this, you will send for the specific investigation and then treat it. Trichomonas vaginalis, I mentioned it in one of the previous podcasts, and another condition which it has been seen, so also syphilis. So they inquire if there is any ulcer, which is painless, down below, if there is any associated other symptoms. So you will send also for certain investigation to be examined and treated accordingly. Not to forget about another thing, which is basically it's a lice infestation, or the genital herpes, which is a different entity. It's a viral, and it could be presented in certain patients, so it will be very painful and tender. So you will ask if there is any soreness as well around the lips sometimes, and you will ask what method or what route of practice do they do. And generally, you will tell the patient while you are under investigation, you need to refrain from sex. And if you have to, you just need to use condom and avoid oral sex as well until you are checked. And if you have any partner or if you have any relationship involved previously, there is a partner notification system. Even if the patient does not want to be involved, that will be sent by the clinic just to make sure that the other party will be treated. So that's basically, in short, about sexually transmitted infection and how to tackle them effectively. And always not to forget about safety netting the patient. Thank you.